Hi, I'm Shannatay Bergeron with Colorado Mountain Medical, a subsidiary of Vail Health, and here today is Dr. Seibert, otolaryngologist. Otolaryngologist sounds like a big word, and it is, but it really means ear, nose, and throat surgeon in layman's terms. So we're going to talk a little bit about the ears. Dr. Seibert, thank you for joining us. Can you tell us why a patient would come to an otolaryngologist or ear, nose, and throat surgeon to get care for their ears?
Absolutely. The ears we see quite a few patients for. It can be for ear pain. Typically those are non-surgical patients, and our PA will oftentimes see them. But things that I think are interesting about the ears that people oftentimes don't think are a problem, maybe their spouse or their significant other thinks is a problem, is hearing loss. Usually it's a conversation of, you can't hear, and the spouse says, well, you mumble, and usually that is actually there's some hearing loss. I would say most patients over the age of 50 have some degree of hearing loss, and what I think is interesting about it, while most causes of hearing loss are non-surgical, it is important to first of all, diagnose hearing loss, and secondly, treat it. There's a significant increase for diseases like dementia and cognitive decline for untreated hearing loss. Another thing that people might see us for is what we call eustachian tube dysfunction. This is typically your ears won't pop and there's some pressure and discomfort, especially when you're flying and in the process of descent or going over a mountain pass and you just really have a hard time popping your ears. This is something that historically was very hard to treat because the eustachian tube is buried deep in our skull and you really can't do surgery on it. The only treatment we really had historically was to put ear tubes in patients, which causes problems because if the ears get wet and the water goes through the ear tube, it can cause a host of issues. Plus, you have to maintain the tubes, perhaps get them replaced. But now there's a procedure that's been around for about 10 years where you can dilate the eustachian tube. This can be done in clinics. Sometimes it's done in the operating room, depending on the patient. But it is very helpful in the majority of patients with eustachian tube dysfunction.
Okay, and for me to understand better, eustachian tube dysfunction, what is that?
So that's the discomfort that people get when they have changes in elevation. It can be as simple as a storm front coming through, but typically it's when they're the descent of either scuba diving or when the plane is descending to land, or just going over a mountain pass. You just feel that squeeze, that tightness, that pressure in your ears, that muffled feeling. That's eustachian tube 101.
Okay, so if you think you maybe have eustachian tube, your ears plug a lot, you can't get them popped, or maybe you have ringing, hearing loss, any of these topics, please reach out to us and see if visiting Dr. Seibert is appropriate for you. You can find our information at cmmhealth.org.